Hello friends, welcome to my channel Breathful Lung Care because every lung and every breath matters. In a short lecture series, must know classical sign in thoracic radiology. In today's lecture, I would like to discuss a very important sign called as deep sulcus sign. So in today's lecture, I would like to discuss what is deep sulcus sign, how it looks like, how to identify deep sulcus sign radiologically on chest X-ray, and what are the conditions in which deep sulcus sign is present. So let us start with the today's sign. Deep sulcus sign. This sign is seen in supine chest radiograph in a patient with the pneumothorax, where their air accumulates in the lateral costophrenic angle, so that it appears as a lucent and deep when compared to the other costophrenic angle. So, deep sulcus sign is present only in supine chest X-ray in a patient with the pneumothorax because of the air accumulates in the lateral costophrenic angle. So it appears as a lucent and deep when we compare to the other costophrenic angle. This sign is visualized in the supine position where air accumulates in the non-dependent parts of the pleura, that is anterior and the basal part. In contrast, when the chest X-ray is performed in the upright position where the air accumulates in the apex of the pleura. So once visualized, one should always look for the other signs of the pneumothorax in cases of the major trauma, neonates and ICU patient to avoid the errors. And sometimes the first deep sulcus sign can be seen in the patient with the chronic obstructive pulmonary diseases because of the air trapping and hyperlucency and the hyperinflation of the lungs. So it is always look for the other causes or other signs of the pneumothorax like major trauma, neonates and ICU patient, and also to avoid the errors, it is also important to rule out the chronic obstructive pulmonary diseases. Let us discuss with very simple example. This is a chest X-ray AP film or the supine film of a 60-year-old female with the sudden onset of the chest pain and diagnosed with the right pneumothorax. So this patient is having right pneumothorax, but the film is supine, so that the chest X-ray shows the right pneumothorax causing the mild depression of the right costophrenic angle, which is shown here with the white arrow producing the radiologic sign, which is called as the deep sulcus sign. So you can see here, when you compare the right and left costophrenic angle, there is a slight depression of the right costophrenic angle because of the presence of air laterally. So this is all about the deep sulcus sign. So I hope you all understand the deep sulcus sign and you will now able to identify what is the deep sulcus sign, so that it will help in the diagnosis. Especially in the supine chest X-ray, it is very difficult to identify the pneumothorax. So when you identify the deep sulcus sign, it will be easy for diagnosis of the pneumothorax in the supine chest X-ray. So please like and share this video and please subscribe to my channel. In the next lecture, I will be back with the one more very interesting sign. Till then, bye bye. Thank you so much.